So I have Natalie here today with me. She's been my patient for a few years, treating her for neck pain and low back pain after an injury she had. And then she developed shoulder pain as well. Obviously, it was from the injury, but slowly, she's experiencing shoulder pain. So we did an ultrasound and then we did an MRI that showed actually significant problems with it. She has mild supraspinatus and anterior infraspinatus tendinopathy as well. So again, inflammation of the tendons. Then what happened with the tendons stop being elastic and actually becomes a cord-like, which will put the tendon at risk of rupturing or tearing under any tension. So what we did before, we did a cortisone injection first, and then she got some relief. But after that, I offered her PRP, platelet-rich plasma, which helped her significantly and improved the tendon and the tendinopathy quite significantly. So today, we'll be doing a second treatment for her shoulder, and I'm gonna ask her a few questions. So how was your experience with PRP?
My first experience, I would say, was good. I was able to have more movement in my arms, things I wasn't able to do, I'm able to do now. I'm an early childhood educator. So with my position, I have to lift children. There's a lot to coming down to their level because I'm dealing with children between the ages of 9 months to 18 months, changing pampers, assisting in feeding, everyday things that you would do with.
Quite physical.
Quite physical.
I would like to say that nobody likes needles, right? Ever, right? Including myself. But the mind will overcome this with the great results from the injection. Going into PRP treatment, knowing that that will be a better alternative than surgery is quite powerful. Treating this instead of going for surgery and being down for 5 to 6 months with physiotherapy, not be able to use your arm is quite significant. I'm gonna leave Gulnaz to do it. She's very capable, skilled, right? And she's gonna look first with the ultrasound, identify the pathology, and then we're gonna go right into it. So go ahead.
Okay, your arm has to be across your chest. So we are going in the joint first, in the posterior glenohumeral joint. She has a mild OA. So we will be targeting around here in the capsule.
So Gulnaz is ready. We finished the intra-articular inside the joint injection with filtered, activated PRP. Now we're doing in the tendon. She's got a lot of tendinosis in the tendon with calcification. Calcification means that the tendon has been wearing out for quite some time. Had injuries, had some calcification, which is similar to scar tissue on your skin. So she's gonna go in with the full PRP, full of cells, and activated PRP into the tendon.
So she has this calcification in her supraspinatus tendon, and around the supraspinatus tendon she has these micro tearing which causing the pain. She has a slight mild bursitis, but the bursa doesn't look that bad today. So we are trying to calm down the inflammation. Actually, the tendon causes the inflammation in the bursa. So once the tendon is healed, the bursitis will also get better. So today we will be doing PRP into the supraspinatus tendon.
Yeah, so as I mentioned before, the procedure really is done under no anesthetic. Actually, it's contraindicated to put anesthetic or freezing with PRP, as it recent study showed that it dilutes the PRP and reduces the effects of it. So the patient has to do it without freezing. We usually advise the patient to take a Tylenol before or after, but the actual pain from the procedure will last from 2 hours to a few hours. It feels exactly like you fell on your shoulder or somebody really punched you hard, which makes sense because it's blood into the tissues. It's like a bruise into a muscle. So after a few hours, we ask the patient to just relax, take some Tylenol, and usually it goes away before the end of the day.